Hi, I'm Ron Graham, your senior benefits consultant with Family First Life. Today, I want to take out a couple of minutes of time. I'm probably going to go fast for 30, rapid fire 30-minute quick overview of the basics of Medicare. And many of you who are moving into this very special period of time of your lives where now it's time to kind of really enjoy the fruits of your sweat equity and all of the hard work that you guys have put in over the years. And so this is the time where you kind of sit back now and start to collect those dividends. And so what I want to do is kind of go into a quick overview just to simplify the basics of Medicare, because I know right now, if you're listening to this video, you've probably started to receive a lot of information in the mail, and you're looking at a lot of commercials and you're looking at a lot of information. And if you're anything like most people, there's a kind of level of confusion and uncomfortability because you're not really understanding what exactly are these people talking about. So I hope this helps. I promise I won't take much of your time. And if there are anything that I rapid fire and it doesn't kind of click or stick, please, by all means, click on the link below. I have plenty of information and literature that I can get out to you per your request. So without further ado, let's dive in. Basics of Medicare. And so what I want to really do is kind of just speak to the 2023 year because this is pretty much where we are. And so again, the turning 65 market, to make it crystal clear, when you think about it, there's a couple of ways that you would start receiving information. And obviously, it is based on your retirement age. Now, real quick disclaimer, certain retirement ages are associated with various things, such as the year you were born. I think if you were born at a certain timeline, you had to be 62, and then it was 65. I think now it's 67, and so on and so forth. You get the general idea. Also, please visit your socialsecurity.gov. That is giving you a basic understanding of your Social Security information. I encourage everybody to turn there as well. So Original Medicare, how does it work? Again, this is a program that is coming to place. It is based on you being an American citizen and working what they call a minimum of 40 quarters. And so generally what it is that you have to pay a portion of the cost for Original Medicare, whatever Original Medicare costs. There are no limits to what you pay out of pocket in a year in terms of Medicare, again, unless you choose a Medicare Advantage plan or some other type of medical health plan. But the bottom line, understand, is that Original Medicare, everyone's eligible provided that they worked a minimum of 40 quarters or that they may have paid into it, because you do have some people on this call that are self-employed or 1099, and they may have to take, well, they will have to take the honors to pay into their Social Security pretty much on their own. And if you do that, this is the benefit that comes a part of it, so that everyone at a certain age who's put the work in is eligible to receive Medicare benefits. Again, the question is, you'll hear a lot of me talk about Part A, Part B, and so on in these different parts. But for the sake of this video, rapid fire, I'm only going to talk about the key ones that you'll hear most time. So signing up for Part A and Part B, meaning if you're close to 65 and you're not getting Social Security or railroad retirement, you'll need to sign up for Medicare, okay? So again, I mentioned you visit the ssa.gov benefits/Medicare. You apply to Part A and Part B, or you can also contact the Social Security Administration 3 months prior to your 65th birthday, okay? So this is why you're getting a lot of the mailers and the information in the mail, because again, you're moving into a timeline where this is happening. In most cases, if you don't sign up for Part B when you're first eligible, you may have a delay in getting your Part B coverage in the future. You may have to pay a late enrollment penalty for as long as you have Part B. This is why cut and dry. You're getting the reach outs, you're getting the information. So people like myself, licensed agents all around the country, we're being notified that we have certain people that need to be aware of the Part B penalties. And so that's why we reach out. Again, it's not necessarily just what can somebody sell you. A lot of times it's just, hey, are you aware of this? And of course, most people don't know. I didn't know this until I got into the industry. Another quick claimer, if you have end-stage renal diseases, ESRD, and you want Medicare, you will absolutely need to sign up for it as well. So you as well, for those of you in that category, will contact Social Security and find out how you can sign up for your Part A and Part B. Quick question, will I get Part A and Part B automatically? If you're getting a benefits from Social Security or Railroad Retirement Board, you will automatically get Part A and B starting the first month of the day you turn 65. Let me say that one more time. If you're already getting benefits from Social Security or the Railroad Retirement Board. So you guys, you know who you are. If this is you, then yes, of course, you will automatically be enrolled in Part A and Part B. However, everyone else, pick up the phone and make the calls. If you're under 65 and have a disability, okay, my under 65 guys with disabilities, you too will automatically get a Part A and Part B after your disability benefits from the Social Security or certain disability benefits from Railroad Retirement Board for 24 months. So again, those are the two primary scenarios, okay? And then the other one, if you have an ALS, which is an amyotrophic lateral sclerosis, also called Lou Gehrig's disease, and I know I butchered that, so don't blame me. You'll get Part A and Part B automatically as well the month of your Social Security disability benefits begin. And for those of my Puerto Rico friends who I love dearly, you don't automatically get Part B. Remember, you have to sign up for it. So again, these are the types of things that we want to make sure we're crystal clear of. Again, what does it look like? We all talk about the red, white, and blue card. Let's just go over this real quick. You will have a name on it, and you will be assigned a Medicare number. So again, not long ago, your Social Security number used to be on this. Now it is a medical MBI number. So for those of you who are concerned, if you are dealing with an agent over the phone, which in most cases, since the COVID era has begun, most of the time you'll be reached out over the phone, or maybe somebody will send you something in the mail. As long as you provide the MBI number, trust and believe your information is safe. Hospital Part A, Part B, the date that you enrolled will always be the date that will need to be remembered, or you can basically just, they always ask this question: what is your Part A and Part D enrollment date? So these dates will stick with you for the remainder of your life. Also, just a word to the wise: for your safety, security, and satisfaction, when you're speaking to an agent, 99% of the time, unless it's in person, you will have to talk on a recorded line. Why? Well, again, this is to protect us. It's not about anything other than protection, because before you would have people saying, well, you know, I don't know how I got in this plan or I got in that plan. And so unfortunately, you got rolled up in a plan, you didn't know anything about it. So all of that stuff's gone away now. Now for the safety and security of this American citizens, an agent must talk to you on a recorded line. Again, that is to ensure that everything is on par and that you asked for what you asked for. So gone are the days of, hey, somebody just flipped me and signed me up to a plan. No more of that. Outside of the normal period, there will be special enrollment in periods that are very similar to what happened on your job, life-changing events. So if you don't enroll in Part B, there is a situation where you will get the penalty waived, provided that certain conditions are met. Special enrollment situations where a person may hold on to an employer plan a little bit longer, or hold on to a spouse's employer plan, or maybe they relocated and moved out of the area, things like that, or they were hospitalized, or anything that prohibited them from being able to make the call. Again, just talked about it, employer union coverage, Medicaid and TRICARE. These are terms that you need to somewhat familiarize yourself with if you fall into these categories. So if you're going to be a union employee that's going to hold on to coverage for a certain period of time, I encourage you all check with your union go-to guide person and ask them, how does it work if I don't switch to Medicare Part A, Part B? I was on a video recently listening to Mr. Ron talk about penalties that I do not want to incur. For all of my military family and friends, you have a program called TRICARE. You still must sign up for Part A and Part B when you're first eligible, because you want to keep TRICARE coverage. So this is for people that are out of the military. They think, oh, I got military coverage, I don't need to do that. Well, you do. You need to sign up for your Part A and Part B when you're first eligible. This absolutely keeps your TRICARE coverage intact, which is a phenomenal plan, by the way. And then if you're an active duty service member, you don't have to sign up for Part B to keep your TRICARE coverage if you're still in active duty. Again, the State Medicare Assistance Office is always there to help. For those of you who are on Medicaid, remember, if you have Medicaid and don't have Part B, just keep that in mind. You may help you sign up for it. Medicare Care will pay first, and then Medicaid pays second. Medicaid may be able to help pay some of the Medicare out-of-pocket costs, like some premiums, deductibles, coinsurance, and co-payments. So this is critical information, guys. Just kind of keep it in mind that, again, this is rapid fire. I know I'm going over this relatively quick, but I just wanted to give you some sound understanding, basic understanding of your plans. Now, how does my other insurance work with Medicare? Again, real quick, if you are a retiree, like in the case of my mom, Medicare paid first, and then her retiree coverage from her job took care of the rest. If you're 65 or over and you have a group health plan, your group health plan will pay first. If you're 65 or over with a group health plan on your spouse's plan, then Medicare will pay first. So you kind of get the idea, guys. So this is really good information to know. Again, when Medicare pays or when your plan pays. Medicare Part A, again, what does it cover? Inpatient hospitalization, skilled nursing, not custodial or long-term care, skilled nursing, using to get you back on your feet. Home health care for somebody coming in the houses to take care of someone. And of course, last but not least, your hospice care. Again, the monthly premiums for Medicare Part A are typically $0 premiums. Once again, $0 premiums. Inpatient and outpatient, just real quick, I'm not going to go too much over this, but when you're an inpatient or an outpatient, affected about how much you pay for hospital services, and if you qualify for a Part A skilled nursing care facility. You're an inpatient when the hospital formally admits you to a doctor's order. That's inpatient. You're an outpatient if you're getting emergency observation services, overnight stay, x-rays, labs, things of that nature without formal inpatient admission. Remember this, each day you have to stay or your caregiver should ask the hospital or the doctor or a hospital social worker or patient advocate if you're an inpatient or outpatient. So again, you always want to make sure you are diagnosed properly as an inpatient or outpatient. Again, why is it important? Because that's based on who's going to pay for what. A skilled nursing facility care means Medicare will cover semi-private rooms, meals, skilled nursing and therapy services, and any other medically necessary services that are supplied at the skilled nursing facility. Now, real disclaimer here, Medicare will only cover these services after a 3-day minimum medically necessary inpatient hospital stay. Again, more information to come on this. I'm going to throw this in real quick. The long-term care facility, I really want to kind of let you guys know, the turning 65 guys, the guys like you that I'm reaching out to, keep in mind that long-term care facility is a separate cost that can get very, very expensive. Now, while there are some great programs out there at very inexpensive prices, provided that you sign up for these programs at the time of Medicare, original Medicare enrollment. Why do I say that? Well, when you're 62, 65, for the most part, you're still relatively healthy, which means that most of the time, these extra benefits are going to be very inexpensive. So for an example, most Medicare and health insurance, even Medicare supplement plans, do not pay for long-term care. Let me say that one more time. Most Medicare, and most health insurance plans, including Medicare supplements, do not pay for long-term care. And the reason why is because it can get very, very expensive. So this type of care includes medical and non-medical care for people with chronic illnesses or disabilities, like care assistance. They need assistance with everyday activities. They may need to be helped getting dressed, bathing, using the bathroom, delivering meals, and so on and so forth. Now, Medicaid may have some options for you to have assistance if it comes down to your financial straps, which most likely happens if this is coming up. So there are some Medicaid situations out there for you, but just remember your limitations at that point are very, very limited. And so if you want to have a say in where you stay, you are better off getting a long-term care product prior to any of these things ever happening. Again, your deductibles for 2022 and 2023, not going to go into it too quickly, but you can see from the slide, inpatient, your daily cost of insurance, for 22, it actually went up from 1,556 to 1,600. Daily co-insurance, 61st to 90th day, from 389 to 400 a day. So these are the types of costs that you have to be aware of. And this is absolutely why you want to be very aware of what type of plans you have. Again, the enrollees at 65 who have fewer than 40 quarters of coverage. So I'm sure you guys are asking, well, what about the people that didn't work? What about the people that didn't report they're working, that didn't pay into taxes? Well, in that case, this chart may apply to you. So instead of you getting, $0 premiums, you may have to pay certain costs that occurred because you never paid into the system. So again, the Medicare Basic Explained, Part A, Part B, inpatient, outpatient hospitalization, Part B, doctors and outpatients. Again, what is not covered by Part A and Part B? Again, I said it before, Medicare does not cover everything. So if you need certain services that Part A and Part B don't cover, you'll 99% have to pay for them yourself out of pocket. So this is, again, why when you are contacted, it's very, very important to look at the information out there and maybe get some of these assistant plans, these ride-along plans for helping with dental, eye exams, and things like that, because of the fact that they'll 99% be very inexpensive if you do it at the beginning of your retirement career rather than the middle or the end. Part B, just real quick, rapid fire, office visits, ER, urgent care, radiology labs, so on and so forth. The monthly premium as to date has dropped. It was $170.10. I think it's down to $164. We'll go over that on another slide. Now, to help with Medicare costs, seniors, adults, disabilities may qualify for different types of programs for low income. I'm not going to go too far into that, but we mentioned that these programs are necessary in the event that monies become a problem. Now, I know that we talked about the income. Income does drive these Medicare rates. So just so you know, there is an income chart. Again, a lot of this information, I can forward it to you. Again, by subscribing to the channel, of course, clicking the link below, we will get this type of information out to you. But you can see where the premiums now drop from the 170 down to the 164.90. And again, this is income less than or equal to $97,000 annually. For a single, $97,000 for a single, $194K for a joint file. All right. Part B, you do have some drug coverage costs that you have to be aware of. 2020 Part 3 total premiums for high income beneficiaries with insuppressive drug Part B coverages. So there are some costs that go associated with your drug coverages. So just be aware that that's also income driven based. Again, not to kind of override it, but you do want to be aware of what costs are in place. This helps you when picking certain types of plans, because now that you know there are some costs involved, it allows you to pick certain plans that will offset those costs. Again, there is extra help out there. We encourage everyone to reach out to your state for local assistance for extra help with medicine. Some of us are on medications that are very, very costly that will allow for programs to help you with extra help. Again, your state offices do have information, and your healthcare.gov is a very, very great site to get more information if you need assistance. And what we're talking about, Part D, again, is all about the drugs. So D for drugs, again, the lower drug costs, protection against higher drug costs, penalties, and formularies. Part D is an absolute necessity to protect you from the ups and downs of the drug market. These costs can get absolutely out of hand, and they can get out of hand very, very quickly. So we want to make sure that we are aware of the drug costs involved. So you absolutely want to sign up for Part D and look out here below. Income less than $1,600 annually, you're getting Part D. You're getting help. Total assets less than $14,000, you're getting help. Okay. And the married couples totals are as follows. Now, Medicare Part D income related monthly adjustment announced since 2011, higher income beneficiaries Part D monthly premiums, again, like everything else, is based on income. And if this chart looks very similar to what you saw on the previous slide, it is. The difference is drug costs for Part D, $0 for those 97,000 and under. And then, of course, as you see the charges to the right, $12, $31.50, and so on and so forth. But again, relatively inexpensive compared to the cost of medications. So beneficiaries who are married and live with their spouses at the time of, but file separate joint tax returns, there will be a modified adjustment rate for those of you thinking that way. Again, that's Medicare A, Medicare B, Medicare D. Now, why did I leave C to last? Because this is the one that has consolidated the process. Your Medicare Part C, AKA the Med Advantage plans, the ones that you probably see more of on your commercials, and most of the time you're receiving the documents in the mail for the one-stop shop all programs. And the reason why someone would go with a Medicare Part C is because it combines the A, the B, and the D all in one convenient location. So at the end of the day, now instead of having the card for A, B, you have a Part D card and another card for whatever you're doing from your employer, or if you're not doing with your employer or any other plan, you can get a Part C plan, a Med Advantage plan that kind of just covers everything conveniently in one location. So these things look like this. The deductibles, there's a copay provided, provided in the network. Extra benefits, yearly out-of-pocket limits, and your premiums. What does this mean? This is a plan that mirrors the corporate plans that most of us had when we worked on the W-4 world, or the W-4 platform. When you had a company plan, you had a card, a HMO, or you picked the PPO. And this is exactly what this is all about. Again, Medicare Advantage plan, like I mentioned in the Part A and Part B, where they don't cover, they will cover. So in their Part C, you can get eyewear, fitness facility, hearing aids, prescription drugs, dental care, over-the-counter products. So those are the things that Part A and Part B don't do, Med Advantage does do. Now, again, what coverage is best for you? That remains to be seen. It could be basically Medicare supplements, Medicare Part A, Medicare Part D, Medicare Part B. It could be. Or you can get a Medicare Part C. That'll do all of those things for you. And then you maybe add on some ancillary products, like I said before, hospital indemnity plans or protection plans against critical illnesses, sicknesses, and injuries. So that is the basics of Medicare. I promised you that it was going to be rapid fire. It wasn't going to hold you much, but I wanted to kind of leave a mindset that it's not too complicated. Need not fret. There's great information out there for you, and this way you can make an informed decision when the time comes. Here, and again, is the motto. We work for you, not the other way around. So make sure when you're sitting down with your agent, you let them know what your needs and concerns are, and you allow them to place you in the program that fits your needs. Once again, I'm Ron G. Appreciate being with you always. Peace, guys.